my dear friends, welcome to Mana TV and Mana TV International, and this is the NRI Guest Show, a very special show today which relates to the entire world. The distress is here and the show is about coronavirus, COVID-19, fear versus facts, prevention and treatment. And to discuss the same, we have an esteemed guest with us here, Dr.Arunima Mamidi M.D. by profession, a infectious diseases specialist practicing in the Princeton area, and she comes with a lot of good knowledge today to educate our audience, our people, why not to fret, why not to be in too much of confusion, and why not to be scared about what's happening. The right treatment and the right approach to the diseases has to be taken into consideration by the people at large. And today, without much delay, I am connecting you with our esteemed guest, Dr. Arunima. Welcome to the show.
Hello, Jyotsna. I'm glad to be here.
Well, before we start, of course, I would want a brief introduction from you about your background, your educational background, and how you have been here in the US handling this infectious diseases specialty. So please give a brief about, yourself to our audience.
I'm from Hyderabad, India. I did my medical college training in Sri Venkateshwara University, Tirupati. And I did my internal medicine residency at Capital Health Medical Center in Trenton, New Jersey. And then went on to do a fellowship or a specialization in infectious diseases at Thomas Jefferson University Hospital in Philadelphia. And I've been in practice in this area since 2003. I have my own practice. I'm a solo practitioner in the Princeton area. And as you can see, it's a very dynamic field and it keeps me on my toes.
I must tell you, you've been exploring, you must have been researching. I mean, every time this diseases, they keep coming up with new names and all.
Correct.
So, doctor, first of all, please explain what is COVID, as they say, or coronavirus. Give us some information about that first.
Okay. I'll try to keep this simple.
Absolutely.
I will give you some science, but I'll try to make it in much simpler terms. COVID is coronavirus disease. So, and COVID-19 is because of the year 2019.
Okay.
And the virus is named SARS-CoV-2. COVID is coronavirus. So, SARS-CoV-2.
Okay.
So, coronavirus is a family of viruses. There's several viruses, as we know.
All right.
And within that family of viruses, there's several what we call genus and species and all that.
Right.
So, this one is a new virus in this family. So, we didn't know anything about it before.
Any speculated origins? Some people are saying that it originated from bats or snakes or some mixing up and all.
So, the speculation or the facts will come from when they actually identified the virus and then they did a genomic sequence to see what it looked like.
Right.
And it looked like the virus which was close to the coronavirus in the bats. So, there are animal coronaviruses and there are human coronaviruses.
Okay.
So, this was closely related to the one in the bats, and it was also closely related to the one which was called SARS, severe acute respiratory syndrome, which was, we had quite a few cases in 2012. It was a major disease, but it was localized to like certain parts of the world. So, it was close to that. So, that's why it's named SARS-CoV-2.
Okay.
Yeah. So, that's what we know now.
Right. And
so, the speculation was that it could have originated in the animal market or the wet market in Wuhan, China, as everybody knows.
I mean, of course, there is a lot of speculation whether it originated in the market, animal market, or the biological lab. Of course, it becomes a point of speculation, of course. But then, doctor, in fact, I must speak about USA right now. I mean, we were thinking that we'll still stay safe, but of course, the global travel and the way people are traveling all over the world, it is being carried to each and every part of the world now. Every country is almost having it, and US itself has witnessed many cases right now. We have some cases in New York, in Washington State itself, so many people are dead right now. So preliminaries first for, this generic, disease. How much is the fear too much? It is over and beyond the normal level of this diseases, or is it real fear or threat?
So, it's a good question. I'm probably sure everybody has that question in their mind. Why is it different from what happened before? Or why is it different from any of the viruses circulating around? First of all, it was new. So, we didn't know much about it, or we didn't know anything about it.
Right.
But we learned pretty quickly, like even
Right.
when it originated in China, and they quickly identified it, they sequenced it, and they said it looks like this, and it looks like the one we've seen before. But unfortunately, there's no effective treatment medication wise. But
Right.
what else can we do is what we can talk about. And why this fear built up is because of the rapidity with which it spread. And
Right.
the earlier ones with the SARS or the MERS, there was another one called MERS, Middle Eastern coronavirus, which caused a respiratory illness in Saudi Arabia. They were very localized. If they were, the case fatality was much higher than this, but they were very localized. And this one started to spread from one country to the other pretty quickly. And in United States, I think we have about like 154 cases so far.
Oh my
but
God.
most of them came from the cruise ship.
Yeah, there's a lot of
the
travel- I mean,
Diamond
they were
cruise
all
ship. There's like
travel-related.
45
People came
cases
from
from
outside.
there. But then we have also noticed that it's spreading within the communities in pockets.
Right.
But soon, it will be spreading like a community virus, like an influenza virus.
Right.
So that's what we know right now. So that's why it's the fear. But it is no different from any respiratory virus.
I mean,
Yeah.
if we look at the statistics about the flu, the flu, influenza itself has killed many people in the United States. You might be having more figures with you, and a lot of people got infected this year itself specifically. And of course, it is spreading now, but then flu itself has taken a lot of lives, right?
32 million people affected so far this year.
32
18,000 deaths.
million people?
Yes, 18,000 deaths. So we kind of ignore these data somehow because we are so focused on this new virus. We
Right.
kind of ignore the virus which is lurking around us and which is around us, and there's a vaccine available for it, and there's a treatment available for it, for the flu.
For the flu,
Yeah,
that's where.
yeah.
And
So,
even then
yeah.
people are dying.
That's because either they're not taking the vaccine, or because they have other comorbid conditions, what we call is other illnesses that
Right,
make
right,
their
right.
immune system weak. So at this point, I want to talk a little bit about how this immune system, or why some people die and why some don't.
Yes, in fact, I'm
Yeah.
curious about it. I mean, if I look at the segment that the kids are not much into this fatalities, where we see old people or different kind of people, So you can definitely address our audience there and tell more specifics about that.
Okay. So when we look at any infection, there's two factors we consider. One we call the host, that is us, and the second one is the agent, or the one which is invading or attacking us. So the agent here is the COVID or the SARS-CoV-2. So any imbalance between these two, right, either the host or the agent, one crosses over the other will cause the discrepancy in the illness. If the host is good, healthy host, no medical problems, our body is amazing. Actually, the way it is created, there's defense mechanisms every step of the way, starting from where the virus enters. It's a respiratory virus.
Right.
So it enters through the respiratory tract. We either inhale it or ingest it, or it goes into the lungs. So there's defense mechanisms starting from the entry of it, and then body has several defense mechanisms to counteract this virus. So if your defense mechanisms are not optimal, then the invading agent, this virus, can be very aggressive. And the second thing about the agent is, if you inhale a lot of it, the inoculum we call,
Right.
like not
Okay.
little bit, but you
lot of
inhale
it.
a lot of it,
Okay.
and then that's also a problem, because there's so much of the virus getting into your body and your body can't counteract it.
Okay.
So there's the imbalance between the host and the agent. So if it's a new virus, we've never seen it before.
Absolutely.
Humans have never seen it before. So
Right,
our
right.
immune system is not hyper
So we
alert.
don't
It's
have
not
anything
tuned to
in
it.
our immunity there to beat it up.
It's not alerted because
Right.
it's not seen it before. So the agent, we are a new host.
Right,
It's in the
right,
bats, maybe say bats.
Right,
It
right.
could have gotten into some other, we call it an intermediate host. It could have gotten into another animal and then got into the humans. We don't know
right.
whether it was a direct connection with the bats or with some other animal in between. We are also new to the virus. So when it sees a new host, you go to a new place, you try to defend yourself, right? It's attacking you.
Absolutely.
So it will invade very fast and very aggressively initially.
Oh my
so
God.
that's
so
the
our,
reason.
our genes
for,
are not modified yet. This means
so
the
that's
human
the
genes.
reason why it was
Oh.
so aggressive in the beginning. But if I have to guess and use my judgment and knowledge, as it passes by, you see, and it is away from where the source was. As it passes by to other countries and
It is
far
away
away, and
from
it's
where the
not
source is.
direct
Right.
contact,
Agreed.
it's to somebody else, and from somebody else to us, I would assume the virulence should
But
go
it
down.
is so highly virulent that it is passing on from people to people,
Very.
and this means it is dividing at a great speed, so
That's-
that they become potential carriers which are having a lot of viruses in them.
That's it will initially be very aggressive because it wants to thrive, right? It will start multiplying in the cells.
Right.
But then once it passes from one person to the other, this person is fighting it, should weaken it, and the next person is fighting it, should weaken it, the next person is fighting it, should weaken it.
Oh my
That's
God.
that's a logic I kind of use to hopefully the virulence goes down as more humans are seeing it.
Right,
And
right,
as you said, mostly elderly people are the ones who are
Right,
dying, like
right.
60 years and above
Right.
are the ones had the high fatality rate. And in China, the whatever the information they put out from the initial case studies and the case deaths, all these people who died either had heart disease, diabetes, or lung problems.
Heart disease, diabetes
And lung problems.
So
Those were the ones who did poorly.
okay, so of course, I mean lung problem because they are, of course it is invading the lungs. Heart and diabetes means of course kidneys are getting infected somewhere after the lungs probably.
Kidneys-
and the heart of course gets affected if it is diabetes, you know.
Yeah, so kidneys can get infected because of the receptors it goes and attaches to the viruses, and some of the receptors are predominantly in the kidney. So like the SARS
Okay.
affected the kidneys before, the
Oh,
SARS
they
one
have these
before.
receptors
So
there.
they go and attach to the receptors on our cells, and then they break into the cell, multiply in the cell, and then invade the other cells.
Oh my God!
That's
So
how the
there
virus
are-
works.
I mean, if in generic terms, if we have to speak about, of course, people from biological, science background may not understand what receptor and all is. So basically, there are organs in our body which are welcoming these viruses, and they are saying, okay, you're welcome to stay here, and we are going to give you more food so that you grow healthy there. Probably is that so?
I wouldn't say like welcoming and giving them food, but it's some affinity to certain
understand.
organs. Like each
Right.
virus has an affinity to certain organs. We
Right.
have several viruses.
Absolutely.
Mostly are respiratory. We have gastrointestinal viruses.
So
Then we have
that's
viruses
stomach,
like
right.
HIV.
Right.
So each one has a predilection for a different thing. So it is because of the receptors on the cells on that particular organ. That's where this virus has an affinity towards.
So again,
So,
so I
yeah.
will reiterate, it will be the kidneys, the heart and the lungs that become very prone to this virus's infection, and that's where people who are having this disease or any kind of problem with these kind of organs are suffering more, or there is fatalities amongst those people.
I would actually put
So-
it as people with heart disease and diabetes, their immune system is not good.
Okay.
That's why they are more prone to these.
Okay.
But the lungs is because it's a respiratory virus itself, and if you have asthma or COPD, or you're
Right.
a smoker,
Right.
if you're a smoker, we have what's called cilia, like
Right,
little
right,
things
right,
that
right.
keep
In
the
the lungs.
virus, everything away from starting from here all the way to the lungs. They don't function well if you're a
Oh,
smoker. So
okay.
those kind of things make these more
Problematic.
invasive.
Invasive.
Yeah, yeah.
Okay.
Yeah, so
I mean, doctor, I have more questions. In fact, a lot of calls were coming in. I think there is some technical glitch there. I will again put the number through. I mean, it is 631-867-1293. I repeat, 631-867-1293, where you can call us live right now. Very, very important topic that we are discussing today, COVID-19 or coronavirus as you call it. So, Dr. Mamidi, one major question right now, in fact, I want to put it across to the masses here. I, in fact, personally witnessed this thing that I went to one of the wholesale shops, and I saw the aisles for toilet paper, paper towels, sanitizers, and water completely sold out. I mean, look at it. If somebody is genuinely in need of a toilet paper or sanitizer or Clorox wipes rather, I mean any kind of disinfectant wipes, they are just not getting it because people are herding this thing thinking a mayhem is about to happen. It is like, situation where everybody's going to die or something like that, and they are trying to quarantine themselves way before the infection comes to their homes or communities or nearby places. This is something not usual of general public behavior, and I believe there is a lot of fear because of this is happening. So doctor, you need to throw some light to our audience, the right things and what they should not be doing.
Jyots, I just want to ask you, like, why do you think from your perspective, like why do you think this is happening? Why are they holding on to these things? I just want to know.
Okay,
like
so
that perspective.
Okay, general public
Yeah.
perspective would be,
Yeah.
oh my God, this infection is about to happen. So what's going to happen is we will not be able to go into the masses. I mean, again, public places and all these shops and all. While the flow of virus is less right now, I mean, 1 or 2 odd cases in New Jersey, if I speak about this place. And what would happen is, of course, if it spreads, I would not be visiting public places, be it grocery shops or any other malls or, you know, restaurants or whatever. So they are thinking we have to be by ourselves for a month or two, probably.
Yeah, if that's a complete fear or a myth. That is not where we are right now. Okay, so it is not that widespread in the community where we are asking people to just stay at home or quarantine themselves.
Right.
That is being done only if you came in direct contact with somebody who has had the infection, or if you have traveled to the place with a large community spread of the virus. Those are the people who should be quarantining themselves or not coming into public places. It is not for general public or for school going kids or you know, workplaces or anything. There are certain recommendations for certain things, like especially for travel,
Right.
or if you have come in contact with someone
Right.
who's had the infection or who's come in contact with someone
Okay.
who has had the infection, because
Right.
what happens is you may not be directly in contact with that person, but you may be in contact with this other person who is been in contact, and this middle person could be incubating, what we call incubating the virus.
Okay.
There is an incubation
Carrier,
period.
basically.
Yeah, we call
Okay.
it an incubation period,
Incubation
not
period.
necessarily a carrier.
Okay.
So when you get exposed to the virus or any virus, all viruses have incubation period. This one we are saying it's between 2 days and 14 days. So between that time, they may not have any symptoms.
Okay.
They may have symptoms as soon as 2 days, or they may have symptoms after 14 days. So if they have symptoms, we know the peak symptom time, they will be infecting others, you know, about 5 to 6 days after they've been infected.
Right.
That's the peak shedding time, we call shedding the virus, and they'll be infecting others. But if they are not symptomatic for the first 14 days, they are incubating, and they could potentially,
Spread the infection.
not necessarily,
Okay.
spread that infection.
Oh,
So
okay.
only those cases, if you are in direct contact or in contact with someone who's been in contact, those are the times you want to quarantine yourself or self-monitor yourself or self-observe yourself,
Right.
for any symptoms. But just to hoard things or sanitizers and all these, again about the sanitizers,
Oh my
they are
God.
not all sanitizers. Actually, what's recommended here is with alcohol based sanitizers
alcohol
with at least
based.
60% alcohol in it. So
Right.
so any sanitizer, the best still is hand washing
Absolutely.
with soap and water, 20 seconds.
Best still is hand washing. The custom method of keeping yourself clean. Keep it in mind. It's not the sanitizer. It is your hand washing which will wash the virus away. So you really got to be very, very particular about that. I mean, I am also seeing this, that of course these sanitizers are sold at a very high price online right now. Some people are trying to take undue advantage of the situation, of course. Well, doctor, having said that, let's walk through the course of this infection now. When you say incubation period of 2 days to 14 days, and then let's take a general example of somebody in the age 40, you know, it gets infected, doesn't know right now. What would be the bodily symptoms per se? I mean, they would vary, as you say, from 2 to 14 days whenever it shows up. Let's walk through this whole thing. What are the first symptoms that would show up? What were the other symptoms, of the worsened symptoms? And of course, if they are fatal, what it is. Let's walk through.
So in China, the symptoms what they had were,
Okay, sorry, doctor. With my question, I'll come back. There is a caller. Let's take this caller
Sure.
right now because
Yeah.
we're trying for long.
Okay.
Hello.
Okay.
Hi. Can you please take your?
My name's Johnny. I was just wondering, how to prevent from catching the coronavirus.
Okay, Johnny, you study in a school. So, well, he
Okay.
asked how to prevent yourself from coronavirus. It looks like to be a young student,
young
who called up.
student. Okay.
Sure.
Okay. So not just coronavirus, right? When we go into public places like schools or any public place, air travel, subways, buses, crowded areas, we are exposed to so many viruses, day-to-day viruses, not just the coronavirus.
Right.
So we are taking that risk every time we go into these public places, every time we go into school, every time we go into daycare. But common sense things that hygiene. So if you come in contact with somebody who is sick, try not to touch your face, not to touch your eyes, not to touch your nose or your mouth. Wash your hands with soap and water for 20 seconds. So keep your hygiene, keep your distance if you know somebody is sick, and try to hand wash. And if you are in a school, I think they should be doing environmental cleaning and all that stuff, and they have recommendations up for each and every place. If you go to cdc.gov, schools have recommendations, workplaces have recommendations. They should take all precautions to do a little bit more than usual now. Now that this is beginning to show up in United States.
That is one thing. So when we speak about the course of the infection, how it spreads, let's create a hypothetical timeline and speak about that.
Yeah. So in China, what happened is they had the most severe form of illness so far, what we know, right? They had pneumonia with this virus. So they had fever, they had shortness of breath, and they had cough, and they had an abnormal chest X-ray. That's the worst case scenario, where their oxygen levels went down. Some of them needed ventilator support, what we call artificial, breathing that will support your own breathing. So that was the worst case scenario. But in a mild case, it could be just fever, cough, aches and pains, just like any other virus. There is nothing specific or special or distinct about this particular virus.
Cough, body aches. Now, if somebody doesn't have fever, would the person still have virus? In the sense, it could only so happen the person will just show up the symptom of cough,
or could be like a common cold.
No, cough or body ache or common cold. No fever at all. Can that happen?
Can that happen? Most likely not, because like 99% of the cases had fever as their main symptom.
And what is the range of that fever? Is it high fever or some
it all depends on the illness and again the host. Fever is a defense mechanism in us, right? Yeah, like it's always why we have fever is we have a foreign body enter in us and we are trying to fight it. So fever is a defense mechanism. So high fever is how high is depends on the each person's reaction.
But then
so some can mount high and some can mount low, or sometimes low temperature is also a sign of infection. But mostly in this case we have seen high.
Low temperature is also a sign of infection. What kind of low temperature? Can you be a little particular about low temperature in the sense?
I can't specifically say, but its normal temperature is like 98.4, right? For some extremes of age, sometimes very young or very old, they may not have the norm, of the infection of a high fever. Sometimes they can have, low body temperature. If they're not able to mount the response. Again, it depends on the immune system of the person.
But
this
is very interesting.
Characteristically, 99% of the patients had high fever.
But this is as an exception. You're saying it's still interesting.
There's always exception
people
to
might
every
not
rule.
reach up to their normal body temperature itself. It is also a sign of a sickness somewhere.
It is not. It is a way. There's always an exception to every rule.
I understand.
So as a clinician, I keep an open mind. If someone doesn't have a fever, I don't rule it out. If they have all other symptoms that fit the picture,
Okay, so one more question now. People, because are worried, of course, common cold, everything, the same symptoms. We have body ache, headaches, maybe they're part of it.
Headache wasn't a very major symptom here. Major symptoms were fever, cough, shortness of breath.
What is the nature of the cough? Is it dry cough? To begin with?
Dry cough.
What kind of dry cough? Would the person persistently cough or sometimes would cough? Sorry,
See, these are questions which are like, if you go too nitty gritty, I mean, we can, it's a case by case.
But then coughing means somebody will still cough actually. It's not like only a little irritation in the throat, but
something
cough.
Something they would know. I mean, especially if they had pneumonia with the virus, it would be a cough that they would know.
And this
but if it did not go into the lower respiratory tract, if it was just in the upper respiratory tract, symptoms could be much milder than what I'm, saying.
And you still are a carrier to pass it on to somebody who's weak will get worsened in their health, this means.
Yeah, someone whose immune system is not up to the mark are the ones are potentially can do worse with this. So that we hold good for that. Even influenza, we say that, right? smokers, people with
Right.
lung disease, asthma, all these, they have to be
Yeah,
extra-
I was
extra
laughing.
cautious.
Why I'll
Yeah.
tell you. So I have a friend. The friend said, "Okay, you better stay away from me because my immune system is less. You are socializing with everybody, being in media. You come near me, you're putting me in a trouble because I am not that strong with my immunity. So probably that's where it is.
I mean, if they know that they don't do well, or if they have not done well with infections before, then they do, self,
Yeah.
monitoring and all that, and avoiding crowded places. It's not a bad thing, but you
Absolutely.
can't live in a bubble.
No, that's
You know,
true. That's
yeah,
true.
yeah.
You have to still go out,
Yeah.
do your things. One question.
Yes.
Anybody having a previous history of pneumonia per se?
Hmm.
I mean, this is eventually converted into a pneumonia. Okay. If somebody has pneumonia itself in the past, are they more prone with the infection? If by any chance, if they contract, are they more prone with their lungs and all, or pneumonia recovers and everything is fine later on?
There
Generally
was
curious.
no particular correlation. We don't have studies out
Okay,
yet, like
right.
with all these
General-
patients. We
general
have
body
like
structure.
close to 95,000 cases now, right?
Right.
Mostly concentrated in China. Most of the fatalities were in China. Once
Right.
they start putting out the demographic data of all these patients, their age, and what their comorbid conditions were,
Right.
and if they had pneumonia in the past, that will all come out only when literature comes out or more
Understood.
studies
Right,
come
right.
out. So right now we don't have that particular information. If they've had pneumonia before, are they more prone to it? But if someone who has had lung disease and are prone to pneumonia, that's what we're talking about. These are all the
That's
people
of
who
course
are at
lung,
higher,
kidney and heart disease.
yeah, had
basically.
higher risk of this infection.
Very interesting. In fact, I mean, of course. So now one more thing. Let's trace back to China. When the infection started first in China, nobody was aware of this disease first of all, and they were active carriers for 14 days, and they were dealing. And it's the most populous country in the world. All the people going around, travel and all. So it took maybe 15-20 days to spread all together,
very
and
fast.
at the same time all these cases showed up, right? So why I'm raising this concern and I mean this issue is for the people who are in the different parts of the world now, if there were no big groups getting infected, possibly we are at a place, I mean in America if we speak about, there are not huge groups who have got infected and or who were not caught on time, or because now we know the
Now-
diagnosis of the disease,
Exactly,
right?
yeah.
And now we know what are the preventive measures for that. From that perspective, how do you see in the United States of America when it is spreading? Of course, it's not very populated, of course, the fear is too much in the people, right?
We are at a good place right now. Okay,
Right.
United States of America, far away from where it originated,
Right.
and now we know that we shouldn't travel.
Right.
Voluntarily shouldn't travel unless it's for an emergency.
Absolutely.
All unnecessary travel is all is
International
a
travel or
alert.
national?
Yeah.
Both?
So international travel. That's
travel,
what.
okay.
So we know that, and we know how it is spread now. We know the name of the virus. We know how it is spread,
Right.
and we know how to prevent it, and we know how to manage the cases if they get serious.
Right.
So those all play into factor, right? When we don't know what the situations are in other countries. We can only
Right.
speak for United States.
Absolutely.
I cannot speak for other countries, but I can say that there are developing countries who do not have all the support system we do. They may not have a ventilator. If someone has a pneumonia and needs a
Right.
ventilator,
Right.
they may not have that available in that hospital.
Right.
So the death rates could be higher in such places where the care or the level of care is
not
not
up to
on
par.
par to
Right.
what we have in United States. And if you see, and we have caught up, we have a task force now, and we have caught up with the testing. Initially we had only like the CDC, Center for Disease Control, just the
Right.
2 labs there that were
Right.
manufacturing the test kits, and they were supplying to the state health departments.
Right.
So now what in situations like this is a public health emergency, right?
Right.
Then FDA, what it does is there's something called emergency use authorization.
Okay.
So private labs can put
okay.
it for approval.
And they can
now
do
they
the
will
test.
start making them at such a faster rate, and they are already making, and now I think they have announced today at least they have 75 kits enough to test 75,000 people.
Oh, nice.
And soon we'll have tests enough test kits enough to test 1 million
So
people.
we are very
So
well
we
equipped
are,
there.
the things are moving at an unprecedented speed. So, and they will be at a stage where they can provide these test kits to other countries too. And
Wow.
right now they are doing to select international laboratories. So, so we are in a much protected environment, and we are in a stage of this illness where we know much more about it.
Absolutely, we're well
And we
informed.
know how to protect ourselves and
Absolutely.
how to prevent the spread. And all hospitals have all prevention strategies in place.
Right.
With the Washington state, what happened with all the deaths, like the 10 deaths,
Right.
and 6 of them came from one nursing home,
Okay.
like a long-term care facility. So
Right.
now they have all
Quarantine
guidelines
right.
sent to all nursing homes in the entire nation.
Right,
So
right,
we healthcare facilities are very well prepared at this point.
Well, that's a
with
very
their
good point
personal
here.
protective equipment, what we call it. And so again, here I want to talk about the masks.
Yeah, of
People are
course,
going crazy
we have
about
to
the
talk about the
masks.
mask.
Yeah.
One more thing, small question.
Yeah.
When we speak about test kits,
Yeah.
how are we testing for this virus? Is it a blood test or
It is
something else?
It is a PCR test, and we do a swab of the nasopharynx. We
Nose.
say, like, not just the nose; it goes back in the back of the
Oh
nose
my
where
God,
the
okay, so
pharynx
it's the
is.
long thing that
it's
goes
a thing
in?
that's
That's how
swab.
the kit
Yeah,
is.
that's what we do for the flu also.
Okay,
Yeah.
all
So
right.
for any viral
Right,
infection, we have like a
So you put it in the
they put
nose.
and they swab it, and then it goes into a kit, and it goes to the state health department, and then
There
they
is no
test
blood
it.
test?
Right now there is no blood test. This is the only test we have, is an oropharyngeal swab going through to the back of the, like we call the pharynx,
Right.
or the nasopharyngeal swab. I think in China they tested stool and urine also, but they couldn't really correlate if they were infectious, people who were found to
Right,
have
because
the
there
virus
were
in the stool
rumors
and
coming
urine,
in that,
but
that
it's all
even the
respiratory.
feces or the
It
the
can
urine
be shed. You know what happens, even though it's a respiratory virus, right? We
anyways
spread,
go.
yeah, it goes all over the body, and then it can be shed in the stool, it can be shed in the urine.
God.
But
Okay.
they can't, they did not make any correlation with the people who had those positive tests in the stool or urine,
Right.
if they were spreading it to others. It was mostly respiratory
Okay.
spread.
Got it. Well, we'll definitely come to the masks now. Masks, big concern. The masks are out, and they're not just out now. 2 months back, I went to a store. I needed a mask because I was doing some repair at home, and the dust had to flow. And I said, I need a mask, and they said, hey, we're sold out. What is the nature of the mask now? Of course, is it mandatory for everybody to wear masks?
No,
No,
absolutely not.
absolutely not.
Okay.
Who wears the mask?
Who wears the mask? So the N95 mask, what they call, the one which is called an airborne mask, which is
Right.
like a tight fitting mask,
Uh-huh.
that is for healthcare professionals only at this point, not for any general public. Please
Right.
save it for the healthcare professionals, because they are in direct contact with the
Right.
patients when they come into the emergency room, and from there on, if they go to the ICU or if they need any special procedures, sometimes doctors have to, you know, get specimens from the lung, like do procedures like
wow.
bronchi. So they are so much closer
That they are very,
contact,
very
so
close,
they
yes.
need those masks. So please
Right.
save those for the healthcare professionals. And the regular other masks, which are called the surgical masks, that is also not recommended for general public at this
Right.
point. It is only for people who are already sick, or who are caring for the people at home
Okay, so
who are
basically, if
already
you are a
sick.
carrier, you should wear a mask, or if you're
Or if you're
caring for it.
infected, we're
Yeah,
not
of course,
talking
that's
about
what- if
carrier.
you're carrier, I'm saying that
infected,
if you're
yeah,
infected,
you
yes.
wear the mask, and people who are caring for the people who are infected should be wearing the mask, but not general
I
public.
get it.
Yeah, so I
But then
wanted to
people
clear
have
that.
cleared up. I don't know whether they were sent back to China or what, but then there is no mask, no sanitizer, of course, as you know. So yes, people, we know there is a medical emergency. Of course, people are getting infected, but then you have to use common sense. As Dr. Arunima said, masks are not for everyone. Spare them for the doctors, the N95 masks. The other masks, the surgical masks, are for the people who are either suffering from the disease, this infection, or people who are taking care of the patients. Spare them there. When you are going out in the public, pretty much, okay, that of course, as a general question I'm asking now, when we are going out in the public, these infected people, even if they are in touch with us, what is the possibility of airborne infection?
So this to what we call droplet. airborne. So the difference is droplet is when someone coughs, the particles that come out, they're bigger, they travel a short distance like about 3 meters and then they fall down.
All right.
So that's droplet.
Right.
Airborne is they're tiny particles, they can go up in the air and can travel far distances.
Right.
Coronavirus we think is droplet.
Okay.
Could there have been some airborne transmission? Could have been, but most of them we think is
droplet.
So maintaining the distance is the
Better
key.
way out.
About 6 feet, that's what we are telling is
Right.
maintain a distance of 6 feet and wash your hands. And try not, if you touched any surface or any, because it can stay on the surface for stay
how
alive
long?
for
Okay,
few hours.
that was the question. How
about
long
8
will
to
this-
9 hours.
8 to 9
thinking,
hours?
yeah, like it can stay
It's
alive.
not 8 to 9 days for sure.
Not
right?
days,
Okay.
it's
I was
hours.
scared.
So if you touch any surfaces where the infected person has touched, that's why you try not to touch your
The
face
same
or your
area.
mouth or eyes or nose. You wash your hands.
Okay. And if it was a droplet infection, and I mean, you're saying stay away, those droplets also will stay for 8 to 9 hours when they fall down on the surface.
Exactly. If you touch those surfaces.
And
that's
about
a
the clothes, if we have them on clothes, it's again 8 to 9
that's
hours.
why what
period.
we are seeing is keeping the hygiene, like wash any less, we call it fomites, like staying on the clothes
Right.
or clothing or bed sheet. That's low on the transmission risk. Mostly is the droplet, but
Sure.
keeping the hygiene.
Sure,
Yeah.
perfect. So, of course, now thank you so much for these inputs, Doctor. Again, I want to come back to my audience right now. Well, when you're calling right now, I know, just place one question. I may not be able to reply back to you right there and then. You should watch the television as we are live. I will just simply take a question from you, and doctor will reply back, and we will not engage in a conversation per se. Well, the number to reach us is 631-867-1293. 631-867-1293. You can give us a call live. We are live here. This is a very, very important topic, pertains to our good health and peace of mind, which is being robbed. And there is a lot of hue and cry from that perspective. Oh, there is one case of coronavirus. Oh my God, we are all scared. Whole towns are getting, scared. So that kind of fear has to go. And that's why we have our esteemed guest here. She herself is an expert, specialist in infectious diseases. We could not get a better person than, her educating everybody. So whenever you're calling, just ask the question and we will answer back everything. In any case, I'm trying to cover most of the questions. I know that because a lot of calls came, they dropped, there's some technical glitch and all was there. But I believe pretty much, Doctor, I'm trying to cover everything from that perspective, where it's more about how you carry yourself out in a situation when there is a medical emergency, how the people have to behave. I mean, that becomes imperative, for any nation to be successfully running, because it's all about economy, the businesses, the peace in the community. I mean, when such incidents are happening, when people are just clearing the aisles, basic need for basic people are being taken away from them. If you're trying to hoard food, if you're trying to hoard these basic supplies, it's per se, I will say it's not a good citizen behavior, basically.
So as you said, we do have to take responsibility as citizens. So at this point, we know it is a public health emergency, but there is no reason to panic and to clear out the aisles. We as responsible citizens, again, we are saying avoiding public gatherings or where you think the high risk of transmission, like Google, I think they cancelled their summit recently because it's going to be, and even I think Art of Living was supposed to have something like that, and that was also cancelled. So those are all mindful things.
Absolutely.
So I think those kind of things would make more sense, and I think workplaces are making their own rules. Work from home if you don't have to be at work, which makes sense.
Absolutely.
I think airlines are making their own rules. I think some of the airlines might be suspending their flights.
True. They have cut off their
so they are being mindful.
Flights.
Yeah. So not everything has to be controlled by the government. Each one or each state or each local health department or workplace or airlines or whatever, they can make like Google or anybody, they can make their own mindful decisions without causing fear or panic.
That is very important, in fact. So, doctor, to sum it up, I mean, with particular things, as CDC guidelines are also there, if you want to reiterate all of them regarding prevention, okay, that is one, and treatment also. We will let's talk about treatment as well, because we have not spoken about it. What is the course of the treatment in a situation when somebody contracts it and he's showing up the symptoms like cough and fever, and of course it goes to lungs and all, and of course breathing trouble happens. What is the usual treatment that is being given recently?
Okay, so let me first, I will talk about the testing and the prevention.
Yes.
So for the testing, now we can be assured that there are enough test kits, but I do want to just shout out to the community doctors.
Right.
I'm sure a lot of people will be asking for the test. So not everybody who asks is, so use your discretion there. If they have symptoms, and if they don't fit into, first again, if they have symptoms like cough, body aches, headache, fever, flu is the first thing we want to rule out anyway, because that's more prevalent than that.
Right?
So first rule out alternative diagnosis before we jump onto the coronavirus. And if they have a risk factor where they have traveled somewhere, or they have come in contact with someone who has had the infection, or who have symptoms compatible without alternative diagnosis, that's whom we should have the priority of having the test done. And again, if they are sick enough to get admitted to the hospital, say if they have a pneumonia.
Right.
So right now it is all what we call supportive care, where you give them IV fluid, hydration, and treat their symptoms. And if their oxygen levels drop or they can't breathe on their own, they need ventilator support. That's what you do at this point.
So
there is no specific antiviral therapy at this time.
Okay.
But they tested, they developed an antiviral medication when the SARS and the MERS was an epidemic. They showed effect in those. So this is a SARS-CoV-2. It is similar to the SARS. We don't know if it will work, but the trials are on the way. So in America, through NIH,
I had a question
in China.
Here. Sorry to interrupt there. I mean, some people were saying there is some medicine which is used for treating HIV patients is merged. I mean, in this treatment, are they giving something? Can you please clarify on that part?
There was one medication. It's a combination pill called lopinavir ritonavir combination pill, which was used in HIV. No data on its efficacy.
Oh,
yeah.
Okay.
It was randomly used once before in cases of SARS, and I think in one of these cases somewhere in another country, not here. But there is no specific data. But trials will go on with medications. But definitely the antiviral which was developed for SARS and MERS, they have gone into trial in China and through NIH at University of Nebraska. So we should have more information, but right now there is no data as such, so I don't want people to think that there is an antiviral therapy antiviral therapy available, but therapy will probably come sooner than the vaccine. That much I can tell you. Because the vaccine, to develop a vaccine, you have to harvest this virus, right? Because it's a part of the virus that you make into a vaccine. You inactivate it and make into a vaccine. So you have to harvest this, you have to inactivate it, or even sometimes live vaccines. Then you do the trial and see if it works, and then it comes into market. So it is a process which we anticipate at least 18 months. But the treatment we might have success with these trials which are in place for antiviral medication.
Thank you for those inputs. And one more question. Any particular food habit to be observed? I mean, they say that it doesn't survive in the hot temperatures, so some soups and all. I mean, just curious, I was a curious home person, when you go back home, you sit at the kitchen table, you think, what should I cook that the immunity is boosted, and this hot soup or something will kill this virus if I have interacted with too many people today in the open area?
Unfortunately, I can't tell you that would work. But heat, what you're saying is the most of the viruses are prevalent in cold temperature, respiratory viruses. So hopefully, once this weather starts to change and when it gets warmer, it will start to die down.
So what is
it's a respiratory virus.
Range?
Now, the colder weathers, there is no average temperature, I can say, but the warmer the weather, the less the virus they survive. Like even the flu and all, we see mostly in the cold weather. Respiratory virus. So it's a respiratory virus. So if you drank something, it's not going to So
I was trying to correlate.
Yeah,
because
but
you drink, it goes through your esophagus.
yeah,
It doesn't
and
go
the
to your lungs.
stomach.
How is it affecting?
So the other, but in general, something which is good for your body, right? Increased protein intake, that kind of gives you more, energy, or to keep yourself, strong. So those kind of things always we do whenever you are sick. You try to, keep yourself up.
So there is one
with
very
us, yeah.
interesting question. It came up from one of the viewers earlier, and it came in the email. Question was, a person uses a sauna, that infrared sauna that he has at home. So if he had to secure himself from any such viruses, going into sauna for half an hour, or say, not half, 10 minutes a day, would it save him?
We have no data on that.
Well, I have weird questions, doctor. When I try to host a show, I try to bring every angle, every nuisance also should be brought in, thinking from that perspective, because the heat kills it. Is it, if somebody is sitting in a sauna, generally I'm curious, the heat of the body will increase. Will it really help somewhere or not? No data.
No data. Yeah.
I know it's an intelligent answer, and I know, doctor, I'm tricky here, but then, of course, people are trying to think from different angles how to create the heat. Of course, in India, very soon, the hot weather will begin. People with places like Delhi and all, it will be in 40s and 45 degree temperature Celsius. I hope that the virus may die there. Still exploring though.
We are only hoping, right? We don't know how it's going to behave. Just by the nature of the respiratory viruses, at what temperatures they thrive, or what weather or what season they thrive, we are hoping that would happen.
So
but we don't know how this is going to behave. So time will tell us. But from what I have to guess, it should become less virulent, because we are far away from the original source, and it would have passed few cycles by the time.
Of course, from people to people to people to people, whatever. Some cycles, some weakening would have happened by the time it comes. We are anyways very, very far away.
Again, our human body is amazing, and it's built in a way to fight several things, and even without treatment. So many viruses we have. Kids have viruses, viral illnesses, they come home. We don't have specific antiviral treatment for these, and then we get better.
Yeah. That's the surprising thing here right now. The kids are not exactly getting that kind of fatality or damage to their body.
Kids or adults who are healthy adults, these are all fatalities have been in people who have been older than 60 years with comorbid conditions like heart disease and diabetes and lung problems. So human body is capable of handling healthcare emergencies or disasters like this. So and we raise kids, we see them, they go through several viruses cycles, and not all of them have specific treatment, and they get better and we get better.
I'm feeling so relieved, with your all the answers and all. Of course, I was coughing a little bit 2 days back. I did visit a public place, went to certain areas, like, man, I'm coughing, but I'm not coughing from that perspective that I have actually dry cough and all. And I was worried, my body hurts and all. But then it's a weather change. It was too cold a few days back. It was windy. If you don't dress up, you are bound to have body aches and all.
Again, this is no different from any. The symptoms are nothing specific or outrageous for this virus. So they're common. But again, worry when we don't have an alternative diagnosis, or if we actually come in contact with someone. Right now we call community spread is you don't have to necessarily be in direct contact with somebody, or you should have traveled. So it's if it starts to occur in the community.
Right.
So just be aware, and if your symptoms that fit and that are not explained by anything else, just do get tested. And the doctors in the community should be aware of that, and I'm sure there will be a lot of requests for someone who has no symptoms. They want to just get tested to be assured that they don't have the virus.
Absolutely.
They would not test positive and just don't use it for use it for people who don't save it for people who absolutely need it.
One question more, doctor. Thank you for brilliant answers and the enlightening all of us. Anybody having flu might also have this virus at the same time? It's interaction of viruses I'm talking about. Somebody is having influenza, and then comes this another virus, right? Coronavirus. Can they be at the same time?
I mean, can people have more than one infection at the same time? It's possible, but it's unlikely. But it's possible. But if I had to guess, in United States, you have symptoms consistent with influenza, and you test positive for influenza, it is influenza.
Absolutely.
So if it looks like it, and tests and it then that's what it is. Yeah.
Sure. Thank you, doctor. And I think it's been a wonderful session. We spent 1 hour right now discussing all the aspects of coronavirus, and of course educating the masses about not getting scared and everything.
Dr. Mamidi, this is Ravi from New Jersey. Just wanted to ask you about the dietary things as well. I heard that if you have some immune boosting foods, that can be a help, like vitamin C. Is this a myth, or what is your take on this?
Thank you so much, Ravi. Very, very nice question. I had asked a partial question. You nailed it.
Yes.
Yes.
Jyotsna did broach that subject. So in any illness, how we see, right, you keeping yourself up, healthy, like eat healthy, eat high protein, or vitamin C may help. I mean, it helps with a lot of respiratory illnesses, but there is no study that tells us right now. It is so early in the disease that nobody is particularly doing a study to see what kind of food will help fight this infection, but just using common sense, staying healthy and eating the right food that can
I mean, home cooked food is better.
High protein, that we have antibodies that's made in that, so whatever that helps boost those responses in the body.
Right.
So so there is nothing that specifically has been studied to say this particular food will fight this virus, unfortunately. But to ease you and to calm you, if that gives you peace of mind, and it causes no harm to you, please do so. I mean, like, as long as it doesn't cause harm to you, and you're not trying some medication which we don't know, or some herb or something which you want to try, which we don't know anything about, that I cannot tell you. But if it is something, a rich food that helps you, stay healthy, you want to try without causing any harm to yourself, please do so.
Well, doctor, my directory doesn't fall short. Again, one question cropped up before you were summing up. The question is about the sugars. I mean, a sugar intake for any kind of infection in the body is not great. I mean, generally asking you, cutting down sugars for some time, would it really help? I mean, just a curious question.
See, these are all, again, everybody's speculations, and different perspectives. There is no direct data on any of these to deprive yourself of sugar.
I mean, in the flu situation, the sugars would have helped, or reducing sugars would have helped, or not? I mean, generally question.
In what situation?
In a flu situation, influenza situation, say.
There is nothing that any study that says that cutting out your carbohydrate intake or sugars that helps.
Perfect.
People,
businesses and all, believe me, I'm not trying to cut down your business. The cake shops, the bakery shops should go well. The sodas and all yours, happily enjoy that. I'm not trying to cut anything anywhere. It's just my curious question of this brain, sometimes it crops in. Anyways, I mean, thank you so much, doctor. Amazing session with so many things we explored, right from the fear and the facts that you share, and of course the prevention by observing the right kind of hygiene and everything, and the treatment that you have. Now with your CDC's notification winding up and everything, you please may sum up for my audience.
Sum it up. So right now it is definitely a public health emergency, but we consider that in United States we are at a very low risk for this infection. So following all general preventive measures, like what you would regularly do for any kind of virus or infection, keep doing that. Maintain your personal hygiene, and if public transport or big gatherings where it's not absolutely needed, if you want to avoid, you can self monitor yourself and self distance yourself. from those, but it is not an absolute necessary. So the workplaces and schools, they have to keep educating people about this and come up with their own environmental cleaning little bit more mindfully at this situation. And there are travel alerts to the countries, people who are traveling. So it is definitely, if it is unnecessary travel, please suspend your travels unless it's an emergency. So there's level 3 and level 2 travel alerts. The level 3 travel alerts are to mainland China, Italy, Iran, and South Korea, and level 2 is at a lower level, that's for Japan. So also be aware that foreign nationals who have traveled to China or Iran, when they return, they can have a temporary suspension for entry. So be aware of these. Check with your local health department or state health departments. They have 24/7 lines available, and cdc.gov. And you'll be talking to experienced and healthcare professionals who will give you the right information. If you are particularly asking to travel to a particular place, or if you are particularly aware of a case in your location or in your locality, and if you yourself are sick, call your healthcare professional right away. That would be the first thing to do, and tell them your symptoms, because if you are going to a waiting room in your doctor's office, you would be exposing others, especially if you are at someone who is at high risk or who has traveled to one of these areas and have symptoms. So be mindful of such things where you have to do some self monitoring, self quarantine, those kind of things. And if people are not sick enough to get into the hospital, they will be staying home with home care and home quarantine, and being monitored by the family members, and the family members have to be following all the preventive measures, the mask and all that. Please save the N95 masks for the healthcare professionals.
Thank you so much. In fact, perfect and a great message that you've given in the end, summing it up, doctor. It was like so nice of you to have come on the short notice and educating our audience, because this is the need of the hour. I know they're reading everything. There are a lot of social messages, that social messaging forwards are coming in, but what is right, what is wrong is still not known. And this is the need of the hour, when we need doctors like you to educate. And we are very, very thankful from at Mana TV studios to so that you came here and you've educated everyone. We're thankful to you for all your nice time that you've spent here educating us.
Thank you, Jyotsna, and you asked a lot of good questions. I wish we could have taken more calls, but I think you covered most of it, and I tried to cover most of it. And again, with the social media issue, again, people have to be, take it with more than a pinch of salt.
Absolutely.
Yeah, so and the right information is available to us. It's go to cdc.gov, all the information is available. WHO, all the information is available with the statistics, and and we are and I am a clinician. I'm beyond a statistician, so I pay attention to what the patient needs. And
perfect.
Yeah, so I hope I alleviated a lot of fears.
Absolutely,
today.
You've done that.
Yeah.
Thank you so much, doctor.
Thank you.
Well, my dear friends, viewers of Mana TV International, this was a special session with Dr. Arunima Mamidi M.D. She's a specialist in infectious diseases, a practicing doctor in Princeton area. She has her own practice here that is also known as Princeton Infectious Diseases Associates LLC. So, well, it was all for you, because the need of the hour, the media has to play an important role in educating and enlightening the masses, and that could all be done due to the great time that Dr. Mamidi has given us today here. We wish you a great health, happy times, and sane thinking. So do not fret. The facts remain the facts, but the fear must go. Brave it in a way as you can by staying safe and following the right hygiene. Wishing you great health. Thank you so much from the studios of Mana TV. Thank you.